In multiple sclerosis. Definition. It is a chronic autoimmune disorder that affects the nerves. The major symptoms of multiple sclerosis are vision loss, pain, fatigue, impaired coordination.
Disease of the central nervous system, which includes the brain and the spinal cord. Myelin is the protective sheath that surrounds the axon of neurons, allowing them to quickly send electrical impulses. This myelin is produced by oligodendrocytes, which are a group of cells that support neurons. In multiple sclerosis, demyelination happens when the immune system inappropriately attacks and destroys the myelin, which makes communications between neurons break down, ultimately leading to all sorts of sensory, motor, and cognitive problems. Now, the brain, including the neurons in the brain, is protected from things in the blood by the blood-brain barrier, which only lets certain molecules and cells through from the blood. For immune cells like T and B cells, that means they have to have the right ligand or surface molecule to get through the blood-brain barrier. This is kind of like having a VIP pass to get into an exclusive club. Once a T cell makes its way in, it can get activated by something it encounters. In the case of multiple sclerosis, it's activated by myelin. Once the T cell gets activated, it changes the blood-brain barrier cells to express more receptors. And this allows immune cells to more easily bind and get in. It's kind of like bribing the bouncer to let in a lot of people. Now, multiple sclerosis is a type 4 hypersensitivity reaction, or a cell-mediated hypersensitivity. And this means that those myelin-specific T cells release cytokines like interleukin-1, interleukin-6, tumor necrosis factor alpha, and interferon gamma, which together dilate the blood vessels, which allows more immune cells to get in, as well as directly cause damage to the oligodendrocytes. These cytokines
Application in nursing. These kind of diseases can be difficult to be treated. That's why nursing have a very important image in this situation by setting all the aims of nursing up that are promoting health and preventing aggravation in the disease of the patient. For example, promoting physical mobility because musculospasticity is common and it is later stage. It's characterized by several abductor spasms of the hips and knees. Also, exercise should be done to prevent complications.
Sclerosis, or MS. It is better to start taking MS drugs early on, rather than letting the disease run its course. That's the recommendation of a new guideline published by the American Academy of Neurology. Dr. Alexander Ray Grant is lead author.
So we know that with multiple sclerosis, there's an ongoing development of new lesions in the brain and new relapses that occurs over time. The earlier we can get in and stop those happening, the more likely it is people will have a long and fruitful life and less disability over time.
MS is a chronic inflammatory condition that causes substantial disability and increased risk of death. MS symptoms include vision problems, muscle weakness, tremors, and trouble with coordination. While some treatments only help to manage symptoms, disease-modifying therapies can alter or change the course of the disease.
We used to have a handful of medications, primarily injection medicines. We now have a number of oral agents, new injection medicines, new infusion medicines, all of them with different side effects and complications and monitoring strategies. So it's a really much more complicated landscape.
If a person who uses an MS drug experiences a return of disease activity, they may need to switch to another MS drug. Some people, whose MS is stable, may consider stopping the use of MS drugs, but few studies have been done about the benefits or risks of stopping MS drugs. According to Dr. Ray Grant, it is important for people with MS to work with their doctors to determine the right course of action.
Really, a lot depends on individual preference. A lot depends on what kind of other medical problems that person with MS has, and is trying to get the right fit for them initially when they start treatment.
Pros and cons. Pros. Exist different treatment for MS. Individual treatment program. MS is not contagious or directly irreversible. MS is not common and it is actually very rare. The average lifespan for someone diagnosed with MS is 25 or 35 years after the diagnosis. It requires a medical diagnosis. The cons. There are no cure for this disease. Also, the treatment is to delay the progression of the disease and manage the chronic symptoms and treat acute ex- ex- exer- to cure acute exacerbation targets barriers, motor and sensory symptoms and effects of immobility that can occur. May occur at any age, more prevalence in females than males.
My name is Dean Wingerchuk. I'm a neurologist at Mayo Clinic in Arizona, and I'm going to talk to you today about current treatments and future treatments for multiple sclerosis. One can think about treatment options for multiple sclerosis in 4 different categories. The first is treatment for attacks or exacerbations of the disease. The second is treatments that try to prevent the disease from getting worse over time. Third is treatment for symptoms. And fourth are future treatments.
Issues apply in Ecuador. Multiple sclerosis is less frequent in areas near the equator, while the incidence and prevalence rise with increasing distance from this particular area, determining a clear north to south gradient, although Ecuador is a low prevalence country with this disease. Conclusion. Multiple sclerosis is a potentially disabling disease of the brain and spinal cord. It is progressive disease which affects the myelin sheath. It is result in myelin delineation, which refers to the destruction of the myelin sheath nerve cells in the brain and spinal cord. This results in impaired transmission of nerve.
Into our webinar today. I'm Dr. Barbara Geiser. I'm a neurologist who specializes in taking care of people who have multiple sclerosis. Today, I'd like to tell you a little bit about multiple sclerosis, who gets it, how it affects people, and most importantly, what we can do about it. If you have questions, please contact us via Twitter or Facebook. So what is multiple sclerosis? It's often been said that multiple sclerosis is a disease that short-circuits the nervous system. It's thought to be caused by an aberrant immune response, where the immune system attacks the nerves in the central nervous system. That's the brain, the spinal cord, or the optic nerves. The name multiple sclerosis comes from the fact that many or multiple sites in the central nervous system undergo scarring or damage. Who gets MS? MS is actually pretty common. We think that right now there are more than 1 million people in the United States that currently have a diagnosis of MS, and more than twice that many worldwide. This is a disease that primarily affects young people, so the most common age of onset is people in their 20s and 30s. It's kind of a sexist disease. It affects women almost 3 times as often as men. It has a racial predilection. Most people who have MS are of Caucasian and very often of Northern European ancestry. And it's the second most common cause of neurologic disability in the young adult population. What causes MS? We don't know exactly what causes MS, but most people think that in individuals who have the right or I guess the wrong set of genes, there's an environmental trigger or perhaps multiple environmental triggers that interact with the genes, and this combination produces the autoimmune response. This combination of genes and environment is thought to lead to the immune system's predilection to attack the nervous system. And when that happens, you have damage to the nerve fibers. We're just starting to tease out which genes are involved, and we're just starting to identify environmental factors. Some very interesting environmental data